chances are someone you know has high blood pressure. Because today, about half of Americans live with high blood pressure, also called hypertension. And for Black Americans, that number is even higher. Why? Black Americans have higher rates of risk factors like diabetes and high cholesterol. A lack of good health insurance or access to healthy food options can make matters worse. But you see, hypertension is dangerous. It can lead to heart attack, stroke, and heart disease. That's why we need solutions, and now. It's time for innovation, access, and awareness. Together, we can make hypertension history.
Hello, everyone, and thank you so much for joining us for today's important discussion. Just a quick programming note before we get started. If you'd like to ask the panelists any questions, please just look below the live stream and you'll see a Q&A box. You can drop your question in there and we'll work to get those questions to our panelists as best we can. My name is Ryan Googe and I am the Executive Director of the Partnership to Advance Cardiovascular Health, or PATCH for short. PATCH is a nonprofit patient advocacy coalition dedicated to advancing public policies and practices that result in accelerated innovation and improved cardiovascular health for heart patients. First, I want to thank the Congressional Black Caucus Institute and its executive director, Vanessa Gradine, for co-hosting this important forum with us. For those who are unaware, CBCI is a nonprofit serving the Congressional Black Caucus that seeks to inform, inspire, and ignite today's voters and tomorrow's leaders. We're grateful for the partnership with CBCI, and we look forward to working together in the future. The Partnership to Advance Cardiovascular Health is the policy coalition. PATCH works with the organizations you see here on the screen to put the voice of the patient and the provider in front of stakeholders and policymakers who help them understand the impacts of policy on patient care for heart patients. Now, our work is important because we find ourselves at a crossroads in cardiovascular health and medicine in America. Cardiovascular disease kills more Americans than any other disease in America. Every year, 800,000 Americans have a heart attack. And every year, around 800,000 Americans suffer a stroke. And within the last few years, after decades of improvement in cardiovascular health, we have seen progress begin to fade. In fact, deaths from heart disease stopped declining and started to increase again around 2011. Now, this is all happening when our understanding of cardiovascular disease and the tools we have to combat it have never been greater. Now, hypertension, or high blood pressure, is a pervasive and growing health problem in our country. Nearly half of Americans have it, putting them at risk for serious health conditions like heart attack, stroke, and kidney failure. And in fact, among the risk factors for cardiovascular disease, high blood pressure is associated with the strongest evidence for causation. That's why this year, PATCH launched an initiative in February to raise awareness about our country's hypertension health. Now, it's fitting that this initiative began in February, which is both Heart Month and Black History Month, because about 55% of all Black Americans have hypertension today. And by age 55, more than 3 in 4 will develop it. So today is our first live program to get specific about a challenge that is periodically in the news but deserves far more public health and policy attention: hypertension and the burden it places on Black Americans. So joining me for the panel today are Congresswoman Joyce Beatty. Since 2013, Joyce Beatty has proudly represented Ohio's 3rd Congressional District. She has served as the chair of the Congressional Black Caucus and currently serves on the House Committee on Financial Services. Prior to her service in the U.S. House, Representative Beatty was Senior Vice President of Outreach and Engagement at The Ohio State University and a member in the Ohio House of Representatives for 5 terms. Representative Beatty is a vocal leader and advocate for the issues impacting Black Americans, including healthcare access and diversity inclusion. Congresswoman Beatty currently serves as the co-chair of the Congressional Heart and Stroke Coalition and is herself a stroke survivor. Congresswoman Beatty, thank you so much for being here with us.
Thank you for having me.
Next, we have Pamela Garman Johnson. Pamela serves as National Vice President, Health Equity and Partnerships and National Executive Director for the National Hypertension Control Initiative for the American Heart Association, where she is responsible for leading the strategic planning for improving the health of communities across the United States by identifying opportunities with powerful partnerships to impact transformative lifestyle and community change. Pamela has decades of strategic planning, change management, marketing, and accounting experience, and serves on numerous boards that serve business leaders, families, mothers, and children. Ms. Johnson, thanks so much for being with us.
Thank you.
And finally, we have Dr. Barbara Hutchinson joining us today. Dr. Hutchinson is the managing partner of Chesapeake Cardiac Care in Bowie, Maryland. Dr. Hutchinson is a member of a number of cardiology societies, including the American College of Cardiology, the American Society for Echocardiography, and the Association of Black Cardiologists, where she currently serves as board chair. She is a well-respected preventive cardiologist who is passionate about caring for people with cardiovascular diseases. Born in Tobago, Dr. Hutchinson received her PhD at Howard University and her MD from the University of Maryland. And while at Maryland, she was the first African American to hold the titles of medical school class president and chief resident in internal medicine. Thanks for being here, Dr. Hutchinson.
Thank you for having me.
So today's program will be structured in 3 parts. First, we're going to discuss the hypertension problem overall. And then we'll discuss the unique hypertension challenges in the Black community. And then finally, we'll discuss some proposed solutions and how we address the problem. So let's get started. The problem. So Dr. Hutchinson, I want to start, as we do with all of our programs, with the basics. So can you please explain to the audience what is blood pressure or hypertension, and why does it matter to all Americans? So if you were seeing a patient today, can you give us kind of the elevator speech that you would give a patient to help them understand how seriously they should take a hypertension diagnosis?
Great, thank you. High blood pressure or hypertension, as we often know it, it's really elevated blood pressure in your arteries. It's usually represented by 2 numbers that we often hear. It's the systolic blood pressure, or what I like to call the pumping pressure in the heart, and the diastolic blood pressure, or the pressure when the heart is relaxing. High blood pressure or hypertension is any blood pressure greater than 130/80, 130 being that pumping pressure and 80 being that pressure when the heart is relaxing. Now, high blood pressure, as we know it, is the single largest modifier risk factor for cardiovascular disease. And I say that because untreated high blood pressure can lead to several things. It can lead to clogged arteries in the brain, causing a stroke, clogged arteries in the heart, causing heart attack. It can affect kidney function and overall cardiovascular mortality and morbidity. So it is very important to treat hypertension to avoid all these comorbidities.
Thank you for laying that medical background for us. So, Mrs. Johnson, let me jump to you. If you're talking to a policymaker like Congresswoman Beatty, or to a health plan or to a health system in your capacity at the American Heart Association, what's the case you would make for why there should be a concerted effort to combat hypertension from a public health perspective?
Yes, well, first of all, hypertension is a major risk factor for the number one cause of death, which is heart disease. And as a result, hypertension is a significant contributor of emergency room visits and doctor visits. So think about this. Hypertension costs the US $131 billion each year. So if we continue to have uncontrolled hypertension in this country, that number is going to continue to escalate. We will continue to have individuals utilize the ER as their primary care doc. And so all it does is contribute to greater pressure on our healthcare professionals and on our communities.
So, Pamela, can you now kind of focus it in a little bit more and help us understand the particular prevalence that you see in the Black community with hypertension. Like, can you give us kind of the public health statistics for what we see in the Black community when it comes to
Oh,
hypertension?
yes, happy to do so. You know, it is an alarming statistic that 55% of Black adults have high blood pressure, 55%. And so when you think about that, Black people are disproportionately have higher rates of severe hypertension. And so that it means that we have to have a more focus on being able to manage our modifiable risk factors and our lifestyle, and then also being more compliant to medication adherence. Now, the other statistic around hypertension is that for Blacks, it happens earlier in life. And so we are diagnosed earlier in life. And so for some, I have numerous friends that were diagnosed with hypertension when they were in their 20s. And so you think it's something that only older people, it's going to affect them, but no, it doesn't. And so if it goes uncontrolled, then you have more damage done to your arteries. And so we don't want that to happen. And so, but there is hope because we do have the opportunity to modify our lifestyles and then also make sure that we are self-measuring our blood pressure on a regular basis.
Thank you for that. So, Congresswoman Beatty, first of all, I just want to say thank you so much for taking the time out of your busy schedule to be here with us and lend some your thoughts to this program. We normally have a patient perspective on any of our live panels, and many people know that you are a congresswoman from Ohio, and some may know that
Yes.
you are co-chair of the Heart and Stroke Coalition in the House. But folks on the line may not know that you're also a patient. So, I was hoping that you could share with us your heart story and how hypertension may factor into it as well.
Well, first of all, Ryan, thank you. And certainly thank you for partnering with the Congressional Black Caucus Institute, where Congressman Benny Thompson is our chair. And certainly want to say thank you to Vanessa, who's our executive director, for being a part of this today and involving me. It's interesting when I listen to Dr. Hutchinson and certainly Pamela Johnson, who has a wealth of experience with the National Heart Association and all of her work. I could not share now, reflecting back, the importance of what they've said. When you look at some 800,000 people a year, stroke survivors, or those who have had a stroke or cardiovascular disease. I was one of those younger folks who was diagnosed with hypertension or high blood pressure to the extent that I was medicated. I was having severe headaches. I was athletic. I was in the highlight of my career and I could not shake the headaches. So, of course, I went to the doctor and they determined is that maybe I can say it this way, Dr. Hutchinson, so people realize my resting heart wasn't resting and my blood pressure was just going up. And so what we found out that my diastolic number was well over 100, 110, 108. So they wanted to make sure that I took medication to bring it down. You know, when you're 28, 29, 30 years old and everything else is going well in your career, and you take it sometimes, you don't take it, you don't get a headache, you don't take it. Headaches come back, you run and find that little bottle and you take it. Well, I did that and I survived until I had a cerebral brainstem stroke. And what was very interestingly, I didn't know what was happening to me, and nor did all of the individuals around me. But I have a great story because I was downtown, 2 blocks from a hospital. And certainly, we know getting one to the hospital early is one of the most critical things. I think I'd like to say I learned how to say this much later that you must listen to your body. My body had been giving me signs for probably 4 weeks. I was in the height of the biggest project. I was a keynote speaker for 5 speeches that week. I was also an elected official, or at least running to be one. and I had had headaches. I had been tired. So you know what I do? I throw water on my face. I didn't even drink coffee then, but somebody said, "Oh, give her a cup of coffee. That'll get her all wired up." And I kept going until the day that it riddled right down the left side of my body and I collapsed. And when I woke up in the hospital, I heard all the stories and I looked down, and why were my clothes cut off of me? They thought I was having a heart attack because of, I guess, how I collapsed. I had been to a luncheon. Somebody thought I was choking. So, what's really important is I tell this story, I'll editorialize along the way. You have to have education and awareness because the time that folks were treating me, everything from the Heimlich to getting me water to trying to fan me, that she fainted, she had a heart attack. And that's what they told the paramedics. And so they were treating me for all of those things, saying, "Oh, she gets hyper, she's animated." So they thought, let's try to bring her to, instead of getting me immediately to the hospital. And so I was very fortunate because I went to a hospital that had a stroke clinic within the hospital. I was treated, and I'm fortunate because while it was a long journey, look at me now. I enunciate words differently than I did before, but if you didn't know me at that time, you would just think that this is my normal speech pattern. After almost a year of speech therapy, electric shock treatments, I'm able to do this. I actually store up all my words in nanoseconds before they come out, so I don't get the stutter, or I don't get what we call in common language as brain freeze, that everything gets kind of stuck. And I've worked out how to master that. Great pride in, I'm wearing 2-inch heels, and they said I wouldn't walk again. I left the hospital thinking I was going home, but I was actually, you don't know all the terms. I didn't hear that word inpatient treatment center. So when they said you're being released, I was so happy thinking I was going home. But the good news is I was well positioned. Thank goodness. My late husband, then a prominent lawyer, was able to have access to health care and got me in an inpatient stroke facility where there were only 11 other patients. And their physical therapy starting at 5:45 a.m. to speech therapy to occupational therapy. You could only have visitors 1 hour on Sunday, and that was provided that you got a score over 50%. And it taught you how to not be angry. Those individuals that were, why me? Why we're angry? I don't want to do this. I can't walk. I can't talk. Didn't do as well. So I decided that I was going to be the stellar patient. So if they said 5:30, I was up at 5 o'clock. Someone had to dress me at that time. And so I went through that whole thing. But I'll tell you one short story that I think helped, in addition to having the best physical therapists that you could have, that helped me. I was fortunate enough to qualify for shock treatments. I had the typical Stroop droop, where I could not eat at first because I couldn't swallow, so I would choke, to going through a special straw and learning how to sip and let everything liquid go through. And a physician came in, and he looked like he was an umpire for a baseball game. He had mitts on, he had a vest, and he asked me if I knew anything about hardball or baseball. And I said, yes. He said, well, when we do this, it's going to feel like that ball hitting the bat at 120 miles an hour. But if you get a reaction, there will be enough elasticity in your muscles that it might work. And so I asked if there were any side effects, and he said, yes, it tends to take the lines out of your face. So I made a joke and said, well, could you do both sides? And here we are today after several painful treatments. It worked. I went home with a wheelchair and passed all of my tests months later. And the first day I walked on the Ohio House floor, I went there in an electric wheelchair, and that was my grace that my husband got me an electric wheelchair so I could be independent. And after more of a year of special shoes and braces, I was determined that I was going to walk. So early detection, listening to your body, changing your lifestyle. I became a vegetarian for 8 years. I am no longer a vegetarian, but I am healthy, and I do try to listen to my body. I then, and you'll love this, Pamela, I then became a spokesperson for the American Heart Association, was on the cover of their national magazine and went all over the country telling my story. And I was one of the first, if not the only, non medical physician or expert or researcher to serve on the board for repeated terms.
It's such a powerful testimony, Representative Beatty, and we're so grateful to have someone like you at such a high level be able to share that kind of experience. And I'm curious, Pamela and Dr. Hutchinson, just to get your reaction to that, because I would imagine that you probably have some family history or friends that you could also relate to. But I'm curious, Pamela or Dr. Hutchinson, your reactions to Rep. Beatty's testimony there.
Well, let me just say, first of all, thank you, Representative Baden, for all that you have done to lift up the importance of cardiovascular disease. Your personal story is so important because so many will not share their personal story because they're embarrassed or people may think less of them, or like these are the natural reactions that individuals have. And because you speak up, you allow others and you give them permission to share as well. And so I'm happy to share my own personal story. And the reason why I came to the American Heart Association, my extended family, they suffered tremendously from hypertension and diabetes. And at the time, I didn't have context for that, right? But then when they started having heart attacks and strokes, they had blindness and they lost limbs. I did not fully understand the magnitude of it until I came to the American Heart Association and I realized one's life does not have to be filled with this disparity. And I also recognized that they had a consistent risk factor, and it was hypertension. So when I was instructed by my physician that I needed to self-monitor my blood pressure, I became like Representative Beatty. I became a great patient because I monitored my blood pressure and I did exercise. I was like Representative Beatty. I was in good physical health, meaning working out, but I had to put up some guardrails, and that meant having self-care. And so self-care looks different for everyone, but my self-care meant that I could not be Superwoman. I couldn't. I wanted to be, but there was no pride in getting this S on my chest. But what it did tell me was, how do I have meditation? How do I incorporate yoga? How do I have the boundaries to spend quality time with my family and friends without the additional distractions, and to get sleep? Now, I'm bringing up sleep because sleep has now been added as one of the risk factors for cardiovascular disease because we're not sleeping as a country. And so when I think about the recommendations that were given to me about how I traveled and making sure that I travel at certain times and things like that, all of those small steps really became what you call atomic habits in my life, and they were transformative. So I never had to go on medication or anything like that. But the key is, though, that I did have a wonderful working relationship and still do with my provider. I listen, I adhere to what they say. And so that is why each of us sharing our story and making sure that we do have that relationship with our provider. If something's not working, you need to speak up and say something. And if you need to move to a different provider, do so. And so I hope that each of us realizes that we do have the power to make the best decisions for ourselves.
That's fantastic. Thank you so much, Pamela. Dr. Hutchinson, I'm curious your reaction to both Pamela and Rep. Beatty's testimonies there. And I'm also curious is what are the challenges that you see among your patients today, in particular, that you may have not seen, when you got first started in medicine? How has kind of the cardiovascular patient changed over time?
Yeah, thank you. Thank you, Ryan. First of all, Representative Beatty, I really enjoyed your story, but as I was listening to your story, I couldn't help but think how important advocacy, having someone to advocate for you when you are ill, how important that was. And secondly, where would you have been if you did not have access to all those things that were available to you back then? And as we look at healthcare now in the African American community, sometimes the problem is we don't have access to things that are available. And you are here with us today sharing your story because you had all access to all those things that can help you. And now, if I didn't know you had a stroke, I would have never guessed just based on how you were able to share with us today. So it points to the importance of having access. So back to your question, Ryan, about how I've noticed things changing. I recall when I was a medical student, I would go to the bedside of a patient with hypertension, and I saw someone who had limbs missing, someone who had diabetes, someone who had end stage kidney disease already on dialysis, someone that was much older. And now I'm finding that I'm seeing patients in my office coming in, luckily, with just hypertension or or elevated blood pressure that I'm able to treat. But sometimes they come in with elevated blood pressure, one, and they have never been treated. They've been told by the doctor, oh, it's just a little elevated. It's almost like you a little pregnant. So it's not treated. Then you have those that are treated, but they're not adequately treated. So although they have been treated for years, their blood pressure is still suboptimal. And then I have those that have high blood pressure. But the one thing I have to realize is that you cannot treat high blood pressure in silo. So I always have to look for those other things that I saw years ago. Do they have diabetes that have gone unnoticed? Do they have elevated cholesterol? And sometimes what I'm finding is that people presenting early with high blood pressure, but they have not been worked up even for possibly secondary causes, especially the younger people that are presenting. So I think there is no one typical blood pressure patient, I would say, but I think we have to be alert, not treat hypertension in silo. And as we treat patients with high blood pressure, also look to make sure they don't have other things that could be contributing to their blood pressure.
Absolutely. Well, Congresswoman Beatty, I'm going to jump to you because Dr. Hutchinson set up a great question there. Can you talk to us about the challenges that the CBC and your colleagues see when it comes to Black health and access to care in America? Like, what are some of the distinct challenges, like from a policy perspective, that you and your colleagues are kind of zeroed in on and trying to do something about?
Thank you so much for that. I think it's education and awareness, or the lack of it, becomes a challenge because it doesn't matter whether you're a member of Congress, whether you're someone in the district, and that could be a physician or a lawyer or someone like any of us. I think information advocacy is huge and was certainly beneficial to me. I think the other thing is, how do we change cultures? How do we look at the social determinants and address them? How do we become a bigger voice as the Congressional Black Caucus? How do we include, whether it's the Institute or the foundation, that people hear all of the things both that the doctor has said and that Pam has said to us, and continue in her role with the American Heart Association? And certainly I'd be remiss if I didn't say, having to take the things that we get from the American Heart Association. President and CEO Nancy Brown has been just incredible and was one of the first to insist, because of those disparities, that we focus on diversity and equity and those things that involve our Black and Brown communities. So, with that, the Congressional Black Caucus is very aware of the disparities in the work we have to do because the number of lives that are lost to the number one killer for women, cardiovascular and stroke disease. So, one of the things that we start is with research. We have an amazing Congressional Black Caucus Foundation intern. As a matter of fact, she is sitting with me in the room now, participating. And so I want to thank Ashley, who is sitting here and is our health expert in her role. The Congressional Black Caucus also has introduced legislation such as HR 7585, which is the Health Equity and Accountability Act. We also have members, diabetes was mentioned. There is a diabetes caucus. We have a member who's diabetic. And to the whole point that Pam made, people sometimes don't want to talk about it. They're embarrassed to say, I'm a stroke survivor, or I'm taking medicine in a preventive way. So we have made sure that Black men, who research will say, wait until the last minute, don't oftentimes take care of themselves. So we have put a lot of attention on healthcare and how we write legislation to help educate, make it aware. We have just about every type of month or day where we bring experts in. We do Go Red for Women, bringing it back to cardiovascular and stroke, Democrat and Republican, Black, white, and brown. We have to all be in this together. And we get together, people from the American Heart Association fly in, Nancy Brown has come in, and we do this whole thing with women. We all wear red on that day. We take a national photograph. We go back to the House floor and we share through our 1 minutes and our 5 minutes so everybody can hear how we have to listen to our body, how we have to make sure that we change the way we eat, how we have to make lifestyle changes. And while that may be easier for some who are able to do it, we have to understand that we are very different in our communities, whether that's a rural community or an urban community. And so we speak to people where they are in making sure that we share resources, how they can go to local organizations. We also work with local organizations, specifically or especially those that serve Black Americans, whether that is anything from the Urban League, whether that is the NAACP, because when we talk about injustices, one of the major injustices that I believe we can look at beyond voting rights is healthcare. If you can't take care of yourself, you can't go on a job interview. You can't go look for that house or apartment to put a roof over your head. You can't complete your education. So we believe that healthcare, taking care of yourself, listening to your body, and being educated is the number one thing. And we are working hard. I'm on this call today so I can do more. So I can say to other members of Congress, members in state houses, members in city councils, that this is a real issue. And healthcare crises is a national issue. And lastly, that is why I can tell you, I have supported research, I have supported funding to go across this country before COVID-19 and during it, because we know COVID-19, a global pandemic, also a health crisis, and would affect Black Americans differently and disproportionately because of other issues and healthcare issues we have, like hypertension.
Representative Beatty, I'm so engrossed in this conversation, I forgot to make the transition. So we're in the distinct challenges section of our webinar. So we're on part 2. But thank you so much for that, and we are so grateful for your efforts in this. Pamela, I want to transition to you, because as we're talking about these distinct challenges in the Black community, we can't have this conversation without talking about social determinants of health. And I think that Representative Beatty actually already touched on that a little bit. But first of all, can you give us a solid definition of what we're talking about when We're talking about social determinants of health. And then can you drill down specifically on how being born Black in America puts you at a higher risk for hypertension and cardiovascular disease?
Happy to do so. I'm going to give you the formal definition that the AHA adopted from the World Health Organization for the social determinants of health, which is the circumstances in which people are born, grow, live, work, and age, and the systems put in place to deal with illnesses. And so Representative Beatty talked about the access to healthcare, the access to affordable quality food, transportation, housing, and education. And the thing that I will lift up about the American Heart Association is that not only did we state that we would focus on health equity, diversity, and inclusion, but we also made 10 very bold commitments to address the social determinants of health. And so we've invested financially into addressing the social determinants of health. And that looks at a multitude of different things. You talked about education. You know, when you think about, and I'm sure Dr. Hutchinson can touch on this, but increasing the pipeline of diverse individuals in medicine. There is research that says that Black patients do better when they have a Black physician. So working to increase that pipeline is really important. We also know just individuals may have access to some food, but is it quality, affordable food? That and those descriptors in front of the food is important because people may have that access, but they're not having access to quality food. And even if they do have access, what do they do with it? How do they prepare it? So it's almost like you have to provide the training and technical assistance even around when you provide someone access. What do you do with that? And then in addition to that, the focus on hypertension, the resources that we received from the Office of Minority Health and HRSA to institute a national hypertension initiative to ensure that we are focused on the quality of healthcare within the clinical setting, but we are also focused on communities. How are we investing in communities so that they understand that they are a part of this ecosystem that in order to receive the best quality care, and then also investing in educating the individual. So, we've done great work. And when I say we, different types of institutions from for-profit companies to federal to state, local, nonprofits. But how do we put it all together? We are not siloed at all. We are living in different places. And so how do you bring healthcare to where the person is? So what you see instituted now is you may have in an affordable housing infrastructure, a healthcare center. You may have that there is a grocery store in that particular facility, or you may see it in a faith-based institution. This is how we truly meet people where they are. And we also, because I'm from rural America, I now live in an urban environment. But when I go home, my conversation has to look a little different because I have to meet them where they are. And more often than not, they always talk to me about health. They do, and they will say, "Can I reach out to you?" And I provide them information because they're seeking it. And I think that we have the opportunity, if we think about this work, that it's not going to be done by one institution. It is going to be done by various organizations from ABC, NAACP, to the Urban League, to the Hispanic Nurses Association, to our social civic organizations. We all have to work together if we're going to make an impact. That means that we all have to advocate along for individuals, for our communities, and to ensure the investments are being made in order to transform change.
Fantastic. Thank you so much, Pamela. So, Dr. Hutchinson, we're on the distinct challenges in the Black community, and we've actually gotten a couple questions in the chat that I think that you can address here for us. One is, Can you speak to hypertension as a hereditary condition and at what age you think screenings should start? And actually, I'm going to add another question to that. Is do you think that guidelines should be adjusted for the Black community? Would you think that that would increase our ability to catch early stage hypertension faster?
Thank you, Ryan, for the question. First of all, I totally agree with you. I'll start first with your first question. The guideline was the second question, but the first question you asked, remind me again, was around
The hereditary nature
the
of hypertension.
hereditary, right? And I was actually going to address that. You know, sometimes we think of hypertension. Yes, hypertension may be based on your mom or dad having hypertension, and as a result, you have that gene or that propensity for hypertension. But you could also say, well, you're eating the same way mom and dad ate, so it gives you the same risk factors. And I think in the Black community, as we educate, we have to recognize that in the Black community, we are a village. And we have to sometimes remember that when we are dealing with the patients that we see each day. They may not be preparing the foods, there may be someone else preparing the foods for them that is loaded with salt. So I think that there may be some genetic propensity for hypertension, but I think we cannot minimize lifestyle. And that is why in treating hypertension, yes, as physicians, we could give medications, but I always like to engage the patient themselves. What can you do to impact your elevated blood pressure? Exercise, watching your diet. We know that the DASH diet, the diet that is low in sodium, low in fat, low in saturated fats, high in fruits, vegetables, and grains, can decrease your blood pressure up to 11 points. So I always engage the patients to pull out their stops. Do what can you do? Exercise, things like alcohol. Men, you stick to no more than 2 drinks, and women no more than 1 drink, because alcohol can increase your blood pressure. So I think all these things, when we're dealing with the Black community, we have to address. The other thing is that I've found is that I have patients often say, well, I've been taking this medication and my blood pressure is better, so I can stop, because they don't understand your blood
Can't do
pressure
that.
is better because you're taking the medication. It seems very simple, but believe it or not, you still have people thinking, oh, my blood pressure is better, I can stop the medication. And then your other question, Ryan, the first one was the genetics, and the second one was
Guidelines.
around the guidelines. Now, all discussion today, we point to the fact that in African Americans, everything seems to be worsening us. We have diabetes, we have worse kidney disease, and I think in terms of the guidelines, being aggressive upfront or being in a more preventative mode by having lower blood pressure requirements for African Americans could only help, because it would prevent all the other comorbidities that we've been hearing about for the last 45 minutes.
Can you talk a little bit too, real quickly, Dr. Hutchinson, about treatment efficacy and the changes that we see among different populations? It's specific to hypertension, of course.
Yes, often sometimes I can tell when I see a patient's medication list, the physician that has been treating them, because sometimes we know that there are some medications that work better in African Americans, or certain medications, the addition of certain medications can help lower their blood pressure. So I think it's important to recognize that as we treat our African American patients.
Interesting. Okay, great. So we're going to move in the last 15 minutes here to the third part of our program, which is about solutions, proposed solutions. And so, Congresswoman Beatty, I think they actually touched on this already a little bit. Would love to hear about some of the specific bills that Congress has been introducing and that your colleagues are working on. But also, would love to get your thoughts on what we can do to help you as advocates, as caregivers, to help champion the cause for health equity and for cardiovascular health in the Congress?
Well, first of all, let me say thank you for that question. And I think we do more of this. I think you have to make sure that people understand the ABCs of this. And I can't thank Dr. Hutchinson enough for how she was able to break it down. First of all, what it is. What are the advocacy groups like the American Heart Association, which many people may not know? I didn't until I went on the board, how heavy they are in research and information and awareness. I can remember the board taking on giant companies. Sodium was a big issue and is for Black Americans in our culture and how we eat. And so all the work that the Heart Association did to educate people about sodium levels, to make sure that different soups that we thought were very healthy, to find out, the first thing in many Black families, you get a cold, they treat it with the same thing, go in there and go to bed, drink some orange juice and take this bowl of soup and you're going to be fine in the morning. Well, if you have hypertension and prone to stroke or predisposed, as I probably was, both my maternal and paternal grandmothers died of stroke or cardiovascular disease. And so I think the greatest thing is teaching educated and uneducated women how to listen to their bodies. And when you feel something, you have to do something. You don't do as I did for months, putting my feet up, putting a cold towel on for 10 minutes and then getting back into it, drinking a hot cup of coffee or tea because someone told me that would make me well and I could go on and do 10 meetings. And Pamela said it best. Find out what is your thing. Meditation, yoga, shopping, maybe for me, going into the spa, or just taking a quiet moment. It doesn't have to involve money. It can be just a quiet moment, a special chair, silence, or a book, or a TV show that's just something for fun. But identify what your time and your space for you. It is so important, regardless of what your age is. Now, back to the question about what we're doing here in Congress. Earlier, I mentioned that through the Congressional Black Caucus, we now have an health equity arm of the Congressional Black Caucus. Dr. Robin Kelly, is the chair of that. She brings everything in from under 40 physicians in for a whole program. She is a big advocate, whether it is maternal health, whether it is creating the moms program. She is very big on cardiovascular disease. We now have 4 nurses who are in Congress and members of the Congressional Black Caucus. Well, 3 now because Congresswoman Eddie Bernice Johnson retired and Karen Bass went on to be mayor of Los Angeles. But we have new members who came in, Lauren Underwood and Corey Bush, both registered nurses. So we are heavily armed to have them share with us things from experience and education that we should do. I have a bill that we introduced in the last Congress, and it's a bill by title you might not necessarily know when we talk about return to work, because so many people, and it speaks to what I think Pamela said, that there's this stigma that people don't want to talk about whether it's I'm diabetic, or that maybe I'm having kidney problems and I have to have dialysis in the morning. Some people then are treated differently in the workplace. Some people are told or suggested, oh, you can't work. I mean, you had a stroke. You can't come back to work. Well, that was the thing for me that was my motivation to do all of this so I could go back to what my new normal would be. And so we have written a bill. We will be reintroducing it in this 118th Congress. It's a bill that works with the Secretary of Labor to make sure that there are job accommodations. For example, going back to work in a state house or even being here in the United States Congress, making sure you have access to get to the floor to vote. And I can brag on our US House of Representatives. They have made sure that if you are up in the speaker's chair, that whole floor will collapse and allow a person who can't get out of a wheelchair to be up there and to be Speaker pro tem. The aisles are wide enough. There are spaces for wheelchairs to go in and be in alignment with regular seats on the House floor. But every place is not like that. And so making sure that there are job accommodations for someone who may have a disability as a result of a stroke or cardiovascular disease, to make sure that people are sensitive to foods that are served in the workplace when you can't leave the workplace. So we have legislation that's focusing on that. But one of the things that I'm really equally as proud of is making sure that people understand Stroke and Cardiovascular Month. Now, it's like I say about Black history. Black history should not only be contained to February because it's American history. Whether it is Stroke Month or Heart Month or Mother's Day Month or Women's Month, that cannot just be for that 1 month. We should use that month to springboard that this is a 12-month issue. We are just highlighting the advocacy and the education so you can continue it in the other months of the year. And the last thing is media. I think it is very important for us to, through your organizations, Ryan, to be partners with media, social media, to do social media drive campaigns because young folks now aren't necessarily looking at the 6 o'clock and the 11 o'clock news, but they are on social media. So I think we should have everybody do an advocacy or tell your story video and put it on Instagram and put it all over social media for young people. Tell us your story, but also tell us what you'd like to know. And those are the things that we can be helpful through the Congressional Black Caucus Institute, that's a partner. They have a heavy research arm. There are interns at all levels there. So I'm going to take that back to Congressman Benny Thompson and say, I will be committed to work with you on advocacy, education, and awareness on this specific topic because people hear and listen to words, but they remember stories.
That's absolutely right. It's absolutely right. It's been my experience. It's the stories that really move folks. Thank you so much for that, Congresswoman Beatty. Dr. Hutchinson, back to solutions. We just got a question in the chat that I want to throw to you. Self-measured blood pressure monitoring is an important tool for partnered care, but many with hypertension don't have access to devices. So how can we advance the coverage of self-monitored blood pressure across the country?
Great, great question. And I would say this is my pet peeve, my daily pet peeve, because we've been talking about hypertension. To know your blood pressure, you first have to have a monitor to monitor your
Mhm.
blood pressure. And many patients don't have access to that. And one of the things I would love is that patients who have hypertension, a diagnosis of hypertension, that they are given a blood pressure monitoring kit, even by to their insurance. I've actually written prescriptions for patients with hypertension to get a blood pressure monitor, and it was turned down by their insurance
Mhm.
company. But the insurance company would pay if they had a stroke and in an intensive care room for $3,000 a night. That beats me. So that's number one. I think they should all patients with hypertension, the insurance should pay for a blood pressure monitor. Now we have remote patient monitoring systems that these patients now have access to, that you could monitor them in between visits, and still you have some insurance companies that don't pay for this. And of course, the insurance that a lot of the brown and black patients have access to, they don't cover that. So, and that is a great way of preventing, again, some of the comorbidities that we see associated with hypertension. So we need to start with the basics, get blood pressure monitoring in the hands of patients who can use them, and those who can't and can use the remote patient monitoring, have the insurance pay for these services so that these patients could be monitored and treated to avoid heart attacks, strokes, and worsening kidney disease.
Thank
Ryan,
you so
can I just jump in? I know we only have a few minutes left,
Yes, ma'am,
but
of
I
course.
want to thank you for that because there is something that this conversation, and I just handed a note to our brilliant research intern, Ashley, and said to her, let's write legislation to say that insurance companies
Mhm,
must pay
mhm.
for the monitors because I can remember when we couldn't get a mammogram through the
Yes,
insurance and we fought hard and got that. When you have it as the number one killer and more than 800,000 people, women a year dying of cardiovascular disease, you've given me enough data. I may
yes.
come back to you and have Ashley call you for data, but here's my commitment. We will draft legislation to make sure that we take on the insurance companies to be able to pay for that and to make sure that we fight for those communities who suffer the most.
I
Thank you so much.
couldn't be happier, Representative Beatty.
Thank you.
And can I just add, and if you need an extra large cuff, it costs more,
Yes, yes.
okay? It's $150 to get a monitor with an extra large cuff. So guess what? Who do you think needs an extra large cuff? There you
African
go.
Absolutely.
American. Yes.
We're solving problems on this
I love
call. It's great.
I love it.
So we only have a couple minutes left here, but I want to finish with this question to each of you. And Congresswoman Beatty, I'll let you answer first, and then Dr. Hutchinson, and then Pamela, I'll let you wrap us up. My final question for each of you is if you can finish this sentence however you'd like to. The state of hypertension in Black America is what? Congresswoman Beatty?
The state of hypertension in America is a healthcare crisis that we need to deal with to help save lives, especially for Black Americans.
Dr. Hutchinson?
The state of hypertension in Black America is a work in progress that will not be completed until we stop operating in silos.
Pamela?
The state of hypertension in Black America is an opportunity for collective impact and investment.
Thank you so much. So, Congresswoman Beatty, I have to tell you, I've got some programming notes to wrap us up, and I'm gonna actually lean off something else that you said around social media. So, just a few programming notes for the month. Well, first of all, thank you so much to the three of you for coming on and doing this panel. It's been fantastic, a lot of fun. I've learned a lot. I know our audience has learned a lot. We look forward to partnering with you this month, which is Hypertension Awareness Month. But as Congresswoman Beatty said, we'll use this month to say we need to do this 12 months of a year. And so that's what we hope to do here in the coming days through May, and then for the rest of the year. So thank you all so much for being here. I so appreciate it. It's been enlightening and a wonderful conversation.
Thank you for having me.
Thank you.
Thank you. Thank you very much.
So I'll leave everyone with a few programming notes for the month. As I said, it is Hypertension Awareness Month, and we feel so fortunate to have had these esteemed women here today to help us bring awareness and highlight the unique burden among Black Americans. But every little bit helps. We'll be emailing all participants after the webinar a social media toolkit with social graphics and copy for Hypertension Awareness Month. And we would encourage you to just send one tweet or one post just to get the word out. As you'd say, many hands make lighter work. So the second thing I wanted to mention is that if you're in Washington, D.C., and you have some time on May the 22nd, you can join the Partnership to Advance Cardiovascular Health for our annual policy summit on cardiovascular health and health policy, where we will have another great discussion on hypertension and how policy can form solutions. So if you'd like to join us in our hypertension initiative or get to know us further, please reach out. Together, we hope that we can make hypertension history. Thank you so much for being with us. Have a great day.
Thank you.